talk a lot about looking at the period to know what's going on with someone's fertility, but how can I use that info if mine is so different every month? Good question. So yes, in an ideal world, someone would come into the group and they would say, my period is this color blood, I bleed for this many days every month, it starts on this many days is my cycle from day one to day one, and everything is kind of the same. And then the provider is able to say, oh, that's such a clear pattern of imbalance. You just have this one and it's perfectly aligned with that exact data you've given me. But that's not reality, and that's not the case for hardly anyone who's ever come into Cultivate Fertility. So more often than not, it's, well, some months my period is red, but then some months it's like brown, and then this month it was a 30-day cycle, and last month it was a 40-day cycle, and you just kind of don't really know what it's going to look like month to month. That is more the case. So first of all, don't be afraid that makes your case or your situation more difficult to understand. That's not really what it means at all. Most people do have a combination of more than one pattern of imbalance going on, but if someone describes, and this does happen a lot, someone will describe their cycle as irregular or erratic, or the signs and symptoms kind of change every month, or the period flow changes every month. That tells me that there's a lot of chi stagnation going on, especially usually liver chi stagnation, because that's kind of the name of the game with that pattern of imbalance. Erratic things, changing things, up and down presentations of things. So there's a ton more information about this in the program. In the fertile cycles section, I walk you through what the ideal period should look like, color, consistency, flow days, what the ideal cycle should look like each month to month. But you don't come in there, most people don't come in with that being all perfect, or you wouldn't really have patterns of imbalance that we need to work on. So it's okay if things are not, if your data set isn't perfect when you start. That's the most common way that people come in here and start, is that their data set is not perfect. Their cycles are irregular. This is exactly what we're going to be working on. But even if things seem really erratic or really unpredictable or different month to month for you, there's still a ton of data in there for me. Okay, so I can still see, is it blood red at the beginning and then it goes to brown, or is it usually brown at the beginning and then red and then brown again? That tells me something else. If it's more about the length of your cycle changing, that tells me something else. So even things that look irregular or erratic to you, which it is fair, they are irregular and erratic, I can still put those into patterns of imbalance and still get a lot of good information from you about what your overall patterns of imbalance are, and especially which ones might be the most prominent for you. And also rest assured that we're never making determinations based on just your period. So the period is a nice report card. Your cycle is a monthly report card of what's going on inside of your body, and not just in your reproductive tract, but all of your organ systems, really. So it is great to have good, solid data from the period each month, but that's not the case for most people. We certainly don't need it to be perfect. We don't need it to be the same every month in order to gain information from that. And in fact, even working through the program, a lot of people will experience changes in their periods because your body is responding to what you're doing, and the practices from each of the stages that you're working through, it's responding to those things. And so you will see differences in your period and in your cycle month to month sometimes. And it doesn't always look like this perfectly linear improvement. Depending on what stage you're working in the program, you might experience changes with your period that aren't perfect, that maybe weren't what you're expecting, but they are showing that your body is working on the pattern of imbalance that we are focusing on in that stage. So instead of looking like this, as your body works on these problems, it looks a little bit like this, okay? And that's good, and that's normal too. So you will learn a lot of skills, and I will be looking at a lot of different data from your period and your cycle to see what that's telling us. And it's not just telling us what your pattern of imbalance is, it's also telling us how you're doing, how you're progressing, and how things are changing inside your body systems. So this is a really important question, because I don't want it to hold you back if you feel like you don't have good data to offer because your periods are different month to month or your cycle is irregular. Don't worry about that. That's what we're working towards. That's the point of doing the program. That's the point of getting your reproductive system back on track and improving your fertility and your overall health.